Good morning. So we have about 3 chapters left here of the Jingui. Normally that's a bit, I guess we just went a bit fast, but even last time we kind of talked about that. So we'll see how far that takes us this weekend. We can always do a little bit of review. I know some people want to go ahead and do the pulses already. I'm not sure yet if that's what I want to do. I'll think about it. Right, and so because of that, maybe if there are questions, we'll keep those for after we finish the women's diseases, right? So that's kind of, it'll be easier, and that way we have time to kind of address other things that might not have been clear, or maybe, revisit some of the more difficult chapters or formulas or whatever, that kind of stuff. We'll fill it up. It'll be good. Good. I don't know if you guys have that book that Sabina Wilms wrote, the translation of the Sun Tzu Miao gynecology scrolls. And it's kind of interesting how, and I wrote a little preface for that, and so it's kind of an interesting observation there that was made, which is that in the Tang Dynasty, Sun Tzu Miao, innovative and forward-thinking as he was, he kind of put children's diseases first, and then children's diseases and women's diseases first, and then all the other chapters in his book were all the other illnesses, internal medicine and stuff like that. And in the Han Dynasty, the women's diseases are like at the end of the book, right? So undoubtedly that this has something to do with kind of like the social position of women at that time. There's no judgment on my part. Even if Dan Dongjing was the most forward-thinking person, he was still, restricted by the time in which he lived, and which we see clearly from the fact that, for example, the original formula was called Xuan Wu Tang, right? But then he wasn't. He called it Zhen Wu Tang. And the reason was that at the time, the emperor of the time had the character Xuan in it. The name of the emperor of the time had the character Xuan in it. And then there's a tradition in China, a rule in Chinese history, which is that you're never allowed to, during the reign of a certain emperor, you're never allowed to write the character of that emperor's name. Like, you have to replace it with different characters. Because I guess it's some type of censorship and to prevent political dissent and political satire, and not to allow people to write criticisms and things like that. So if you were to break that rule, break that law, you'd probably be, in big trouble. So also there you see that, he didn't really have a choice in that matter. And I tend to believe that that's the same thing, is that he also didn't have a choice in the matter as far as where to put women's diseases in his book. I think it was just commonly accepted that was just a lesser part of the medicine, right? And so it kind of came later. And I always jokingly talk about it, which is like, oh yeah, he puts women just before the insect bites and the poisonous snakes and things like that, So it's kind of interesting how then in Tang Dynasty you see Sun Tzu Miao kind of come from a place where he says, well, actually, without women, there are no children, and without children, there are no adults. So I'm going to start with women and children first, and then we'll talk about the adults later. So I like that too. That's very nice. And, he became the darling of the feminist movement of the Tang Dynasty. And so, so here we come to those few chapters, and then the chapters start with pregnancy, right? And then continue with postpartum conditions after you've given the child, and then some complex illnesses. Based on the woman's unique physiology, right? There is no andrology chapter per se. There is deficiency taxation, and there is the water chi chapter, and there is the fox and confusion, and there is like dribbling urination. But those diseases, women can have them also. You know what I mean? Like, now we know that sometimes dribbling urination is due to an enlarged prostate, and indeed a woman cannot have an enlarged prostate by virtue of not having one. But it doesn't mean that women can't have dribbling urination. It doesn't mean that the formulas for dribbling urination that treat prostate issues in men can easily treat dribbling urination in women, although then it won't be due to the prostate. You know what I mean? So same thing is like, oh, well, loss of semen, women obviously can't have that. Yeah, but all the lines that talk about it, they speak also about loss of blood at the same time. So if a man were to lose semen, then the equivalent for that for a woman would be that she loses blood. So again, nothing unique there. So the guys ultimately are not that unique. The women, because of the unique function in light of reproduction and the procreation of our species, there's a unique organ, and that by virtue of that being quite a big event, and the prominence of that organ in a woman's life and all that, the illnesses are very, very specific. There are illnesses that a guy just doesn't have. A guy just doesn't have vaginal discharge. A guy doesn't have postpartum illnesses and things like that. That's just extremely unique. So that's why he dedicated some chapters to it. One of the reasons why I personally don't think that Zhangdongjing was kind of conservative, the whole zeitgeist was maybe a bit conservative, and women were in a lesser position, and men were in a much more dominant position, maybe more patriarchal society. But I think Zhangdongjing, it doesn't strike me as such, regardless of the fact that he still puts these chapters at the end. His disciples, his main two disciples, Wei Xun and Du Du, right? They were the authors of the first specialty books in Chinese medicine. One wrote a book on gynecology only, and then one wrote a book on pediatrics only. And then especially pediatrics isn't even mentioned anywhere in Zhangdongjing's works, right? Pediatrics are not mentioned in any of his books. And so that's pretty unique also. So the gynecology already, Zhangdongjing himself, he kind of laid down the blueprint, right? So I can only imagine that most of the gynecological stuff that was in his disciples' works probably was based on these 3 chapters, the 36 diseases in these 3 chapters, so there must be overlap and maybe elaboration and so forth. But of course on the pediatrics part, nothing, right? There is nothing. So normally now we kind of look at Chinese medicine pediatrics, and we look at Chen Yi, and I'm kind of blanking on what dynasty that we're talking about. Was it Song, I think? Song or Jinyuan? I can't recall right now at the moment. But Chen Yi pediatrics is kind of seen as like, Xia Er Zhi Yaojue, right? That's the book he wrote. It's like essential keys to directly point out the patterns of children, right? Directly pointing out the patterns of children, or straight, So it's kind of like a book exclusively dedicated to children, and it's often now regarded as the main book. But actually, about 800 years before that, there was already a book written by one of Zhangdongjing's disciples about pediatrics. Unfortunately, and of course, I'm sure you've already picked up on it, those are lost works. If they weren't lost, I wouldn't just be introducing them, I'd actually have been studying them and so forth. So they are lost works, nobody has ever seen them. We only know of their titles and their authors, but the books themselves are gone. But because of that, I do think that I can only imagine that Zhangdongjing, was very pro-innovation and definitely not unwilling to break the mold, if he has his disciples write books especially about that. Because clearly what's missing was, of course, that the disease of children is never discussed in his work. Now, how then do we address the diseases of children? Well, personally, I feel that the diseases of children are nothing but the diseases of small adults. Right? It's kind of the same. I mean, yeah, there's a certain amount of illnesses that you don't have in children. For example, rare to see a deficiency taxation, rare to see a postpartum illness in a 5-year-old, obviously, right? But otherwise, they can have almost every other condition, right? There are, of course, also a bit more like contagious illnesses, but again, that's the whole thing. The whole book treats contagious illnesses. I mean, we're talking about all the childhood illnesses, right? Measles and stuff like that. But ultimately, all of this stuff, it's all part of that. It's like the whole book, the whole Shanhan treats contagious stuff. So whether that is like with an actual pathogen, or whether it's just purely atmospheric, it doesn't really matter. You just rectify the physiology. You don't necessarily fight the pathology. And the only formula that I see that is a specialty formula is, that kind of measles one, right? The Gugen Shengma Tang. That's the only formula that I see Dr. Tian use that that is not really in the Dandong works, But then again, you look at that formula, it's pretty much based on that whole Shanghan approach. I mean, Shengma antitoxin, Gugen Yangming heat releasing, you're using Chishao instead of Baishao, but still, to me, that still looks very much in line with the system. So I can see why Dr. Tian would use that for measles, for example. Right, and then you see, a bunch of those fire spirit people who lived and worked. I mean, the titans of the fire spirit school. The people who worked around from the 1950s to the 1970s and 80s in Sichuan or Yunnan region of China. The people who are really known for their high doses of aconites and gingers and things like that. You see them treat those childhood contagious illnesses, and they still figure out ways to treat it without using too much cooling methods. And often they fix the measles conditions, or they fix the pox conditions, or they fix the rubella conditions with warm herbs when the conventional TCM physicians failed to fix them with cool herbs. I mean, there's so many case studies out there of them after the blisters have formed in pox, of them what they call is sojiang, astringing the juice inside the blisters, right? Like pulling the juice back out of the blister, with baitong tang, for example, right? Which is fuzi ganjiang and congbai. They've got really good at that. So I think that's a very interesting. I'm not skilled to that level. I haven't seen enough of those childhood illnesses to be able to really do that. I also personally don't master a very advanced diagnostic skill yet for children, right? Because the pulses are a little harder to take on children, and normally, the finger diagnosis is very important. But but they are able to treat conditions with formulas of the system, even though they're contagious. Well, I mean, if a cooling herb can kill a bacteria, and then you think of an herb like aconite that is so toxic even to a human being, let alone to a bacteria, right? I mean, why wouldn't the bacteria die with an aconite? Why wouldn't, it's the same thing. So ultimately, if you're able to read it, you can still fix it. So what am I getting? So basically, pediatrics, what I'm trying to get is pediatrics, though undiscussed in Zhang Dongjing's original works, there are a few special methods out there. Most of the stuff is still pretty much in line with the adult stuff, which basically means you're looking at the child as if it were a young, small version of an adult, a mini adult, right? So it's kind of similar. A last note about the pediatrics is that Dr. Tian does, however, have a very advanced system of finger diagnosis for children, where he has the same thing with the pulses, like this pulse, this formula. He has the same thing for the fingers, this finger pattern, this formula for the Shanghan and Jingui formulas. And that is something that is just unbelievably rare now. I mean, rare to the point that my teacher didn't master it really. My teacher probably did not spend enough time with Dr. Tian to see enough children with him to be able to systematically learn all the finger patterns for all the formulas. Now, there are no finger patterns for every formula, just like you have for pulses. That is not true. But there are finger patterns for, rough estimate, I haven't counted them, but I'm going to say 50 or 50 to 70 formulas would that have finger patterns. And that is pretty amazing. That is really amazing. So I'm definitely going to revive that. Because I know the basics of finger diagnosis. I don't know all the weird terminologies like inward hooking and purple versus red versus scarlet versus. There's all these different terms used when he describes it that I haven't even heard of. So somehow I still want to make it my task to go back to China, take some more classes in pediatrics, try to find some pediatrics people who at least can explain to me how it is diagnosed, what you're looking for, and then just really see hundreds and hundreds and hundreds of children just for the diagnostic sake. Like, I don't care what they're going to prescribe in TCM, but I just want to see the fingers, and then I want to be able to learn what it means when Tien says it's an inward hook that's purple, blah, blah, blah. It's this formula. I want to be able to see, okay, what does that look like? What is the chief complaint of the child of the Tien finger diagnosis and formulas that which one would it be? And then try to reconstruct that system, right? So that'll be something I want to work on. I don't know when, but I'll have to find some time to do that. And unfortunately, it's going to involve going to China, so that kind of sucks. But because it's the only place where you can see a lot of children in the outpatient department, just like day in, day out. You know, like I see kids in my practice, but I see a few a week. You know, I need to see 30 a day and do that for a few months, so I can see like hundreds of fingers pass my review, and then, you know, take pictures with a good camera, like take the picture and then standardize. Okay, this is what it looks like if it's a purple hook, or this is what it looked like if it's the wind passage, blah blah blah. You know, like take pictures, so then if I ever run a seminar on it, so I can put those pictures up and say, this is what it looks like, right? And this is the chief complaint, this is the formula. So catalog the material. But that's for the future. So for now, there's no particular pediatrics, extra pediatrics instruction. That said, the only thing extra is the diagnostic skill. The formulas are the same. The formulas used for the children were exactly the same as the formulas used for the adults, right? Like, you know, that's nothing different there.
Dosing? Do you reduce your dosages?
Yes. Yes, I guess you could have guessed that, right?
Yeah. I'm just wondering
if there is a system.
Yeah.
I mean, personally, I feel that as soon as a child is around 10, they can basically take adult doses, especially if you work with granules. As soon as they're 10, they can take adult doses. The only difference is that it'll move faster, that's all. But, I mean, if you look at some of the 10-year-olds nowadays, I mean, some of them are almost taller than me, you know what I mean? So yeah, they're fine. They can take it, especially after the age of 12. I don't care, even if you're a small 12-year-old, you can take an adult dose. You know, and then you just gradually decrease as they get younger. So it's just about the size of their body that matters, the mass. Yeah. They just get better faster. Most of the time, they just get better. They respond faster. I don't have a fixed formula to say, oh, at this age, it's this much of an adult dose. I kind of played by ear based on the situation. If it's a chronic condition, if it's something that they've had for a long time, if it's, I don't know, like something semi-congenital or whatever, you know it's not going to turn on a dime. So you know there's no need for you to force it with high doses. You just kind of do regular dose, and you know it's going to take a long time, you know. Yeah, but of course you do less, yeah. Good. Right, so that is the pediatrics aspect, which is not much going to be discussed here. Which, you know, the other thing that's also obviously not discussed is a special section for the external medicine, right? Like which includes skin diseases. External medicine includes skin diseases. It also includes boils and ulcers and all those things, but it also includes skin diseases. So not a whole lot of stuff mentioned there either, because again, according to the ancient 4 classes of physicians, Zhang was a GE, which is an internal medicine physician, as opposed to people who treat stuff that you see on the surface, which are called Yang Yi, which are called like the sores the doctors that heal the sores, right? Which are the surgeons basically, which includes skin conditions. So that's probably why he didn't necessarily develop that, because that's not the class of physician he was. Second of all, I would also say that, of course, those conditions have they're less likely atmospheric, first of all. Second of all, they're less likely to be deadly because they don't immediately destroy the functions of your organs right? So he was focused more on internal medicine and on making sure the organs remain more functional rather than the skin diseases, which often have a lot of annoying aspects, annoying symptoms, and are maybe very unsightly, but ultimately that being kind of a cosmetic issue, which I would hate to have one, don't get me wrong, but if you're just a total pragmatic person and you have to choose between one person has an illness that might kill them and one person has an illness that just itches and makes them look a little bad, you have to choose to first fix the person who has the deadly illness, right? So that's kind of from that perspective. When those are the two choices to be, when that's the choice to be made, those are the two options, then you will choose the internal medicine first. And that's probably why I think he never really developed that part. Same thing with psychology. I mean, there is some psychology in Zhang Dongjing's writings, but most of the psychological conditions, except for suicide, but most of the other psychological conditions that you would encounter aren't lethal. They aren't deadly. They are not leading to, potentially you say, oh, well, a person is manic and doesn't go to sleep or whatever. He does treat mania. He's got tons of times that he talks about mania. And if they don't sleep for long periods of time, well, they'll get a deficiency taxation condition. So again, then you can fix it again. But again, because if you had to make that choice in his time between we rescue the person who is in immediate danger versus the person who, is kind of like messed up emotionally, but not necessarily going to die of it, right? So again, I think that is why I personally think that psychology isn't really discussed in this medicine. Another reason, and I've mentioned this before too, but that's on a more conceptual level, one of the reasons why I do think that psychology is not really mentioned is because it wasn't ever seen as a separate field, right? I think it was just part of the whole thing anyway. Plenty of places, as part of a physical disease picture, there is mention of a mental emotional symptom involved, right? Where people have vexation, or people have dreams at night, or people have this, or people have that, or delirious speech, or mania, or things like, taciturnity, lack of desire to talk, lack of desire to eat, which are ultimately kind of also psychological things as well. So it's often mentioned as part of the whole condition. So since mind body were not necessarily seen as very separate, I think that's also why the field wasn't developed as a separate field per se, right? And then of course finally, which is no matter how much we want to how should I say this, we want to believe and we want to think that actually spirituality is a big part in our lives this day and age. I would argue that actually it no longer is. Because illnesses of the mind, if I'm going to call it an illness, but like challenges of the mind and challenges of the spirit and challenges of the emotions have to be dealt with through the emotions, through the mind, through the spirit. And often those are of existential nature, and those have something to do with the questions about life and death, have something to do with, your place in the world, all of those things. And there is no medicine for that. The medicine for that is you need a community, you need friends, you need a social circle with people you can trust and you can talk to. You need to have spirituality, you need to have everybody needs a guru. I don't care who he is, if it's the Pope, or if it's Sai Baba, or if it's I don't know who, you want to use, but everybody needs that figure in their life that you go to for advice, right? Everybody needs that, and preferably not just a mere mortal, just like your buddy or something. I mean, yeah, that fulfills a function too, but your buddy, your drinking buddy at the bar, might not be the right person to ask about existential questions of why are we on Earth, right? Because he likely is still also figuring it out. So you want to have a person who's like a professional who deals with those matters of spirit. So I think in the old days, considering medicine came out of shamanic medicine to begin with, I think in the old days still had access to people who concerned themselves with that subject matter kind of full time. And nowadays, I think though people go to church, or go to temple, I don't know in how far they confide in those people that they go listen to their sermons, and as to how far can you rely on those people for advice, and I don't know. I'm just, I just don't know. So I think that's why a lot of people, they go to the doctor while they should have gone to see their priest or their teacher, their lama, their whatever. You know what I mean? So they go to the doctor, and who's a medical professional, and then the doctor is just, like I said, a mere mortal, and they're just going to be like, well, I don't know, but take this pill and forget about your problems. And that's kind of what we do, right? I am always shocked. Even yesterday in clinic again, I think more than half of the people we saw in clinic are on some type of antidepressant medication. I think the first thing I said after getting out of clinic and getting in the car yesterday was like, is nobody normal anymore? Like, what's going on in this world? It is not normal. That is not normal, but it's become the new norm. But it is not normal that you try to medicate away your human experience, right? The anxiety serves the purpose of you then propelling you on your quest for answers, right? So anyway, I think also there, I think that's why maybe in the old days, because the medical field wasn't trying to medicate away a person's search for answers. That's why there's not a whole lot of psychology developed as a field in the medicine of the Han Dynasty. Not that they didn't suffer the way we suffered. The same thing. Human desires have not changed in the past 20 centuries. But they knew where to go for answers, and it wasn't their doctor. Right? And that's, I think, a big difference here. So I think the biggest mistake Chinese medicine as a field is making right now is incorporating psychology, trying to incorporate psychology, and it is completely misplaced. And trying to incorporate spirituality, which is out of place, absolutely out of place. We are also nothing but mere mortals. We are not professional spiritual practitioners. You know what I mean? We are not monks. We are not priests. We are not rabbis. We are not. That's different. That's a different art. So that's just what's happening nowadays, right? Good. So which leaves us with no psychology, no dermatology, no pediatrics, which leaves us with women's diseases, right? Because women have these very specific organs that men don't have, and then those organs can, of course, malfunction sometimes. And then the primary function of that organ is to procreate, right? The primary function of the uterus is that's where the future child gestates for those 40 weeks, those 9 months, right? So that's the primary function. So the first thing we're going to talk about is going to be pregnancy, and the first women's disease is going to be the pregnancy itself. Now, obviously, that's not an illness that you contracted. It's a physiological feat. But still, you want to regulate it and make sure that it goes smooth, and that's why we kind of look at it as, okay, if you're slightly off balance, then how do we rebalance that? So, as you will see here, you've seen this throughout the thing. This is here number 40, pregnancy diseases, right? CH20 means that this is the original 20th chapter of the Jingui, right? That we already know that. And then WD1, and WD1 means women's disease 1. And the reason why I put these here is because in the very early intro, when we did our intro to the Jingui, remember all those crazy diseases, the 18 young diseases, the 18 yin diseases, blah, 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 right? And then it says, and the 36 women's diseases, right? And so in a quick mention, he just threw that number 36 out there. Now, why the number 36? I'm sure some very wacky people are going to play with that number and say it's a numerological code for something. No, it's just 36 diseases, okay? Whatever. 36, whatever. Zhang Dongjing basically, in his clinical experience, looked at these 36 as the main illnesses that occur for women, right? if you know how to treat these 36. These are the 36 types of irregular presentation in women physiology, whether it's pregnancy related, postpartum related, or whether it's just when you're not pregnant or not postpartum, right? So he saw about 36 common diseases for women. Are there more? I'm sure there's more, right? But I know we're only learning 36. That's where the beauty comes into play. You learn 36 because these 36 are unique and their treatment is not covered by all the other formulas mentioned in the Shanghan and the Jingui. Right? So these 36 are extremely specialized. Although, actually, still, the treatment of some are still by borrowing formulas from the Shanghan. Right? For example, here, Gui Zhi Tang, Xiao Tang, Fu Zi Tang, those are all, Jianzong Tang, those are all formulas from the Shanghan Lun that we borrow to treat these diseases when they occur in women, right? But most of them, I would say, are kind of specialty formulas. Gui Zhi Fu Ling 1 is Gui Zhi Fu Ling 1, right? Can we use it for more than just a growth in the uterus? Sure you can, right? But it's mentioned here as a very specific gynecological condition, right? So for that is just an example, right? So these are the 36. And in my experience, and I've been practicing this system now for 13, 14 years, and try to fix everything only with formulas of this system, right? I mean, and the few times that I've tried to use other formulas from outside the system, I personally have not been really satisfied with the results because I'm used now to the results that these kind of formulas create, and I think they're consistently better than the results that non-Shanghan Jingui formulas create. So I'm just going to stick with this. I must say that I have yet to encounter a female disease, a woman's disease, that needed a treatment that was not recorded in the gynecology chapters. Right? No presentation, whether it's too much bleeding, not enough bleeding, skipping periods, no periods, infertility, postpartum complication, X, Y, or Z, whatever. Like, no illness that I've encountered required a treatment that was not in the gynecology chapters of the Jingui, right? And the times that the woman had a symptom occur of gynecological nature that wasn't treated with one of the formulas of these chapters, then it was definitely treated with a formula of the Shanghan or the Jingui at large, which just meant that the pathology that originally the problem that originally did not have anything to do with a female physiology, common cold, respiratory issue, digestive issue, ultimately also disrupted the functioning of the female physiology. And then by fixing the disrupted physiology at the stomach, actually the periods got better too, or whatever, the discharge got better or whatever. Right? So then ultimately that means that it still is covered, right? So what I'm trying to conclude is that I personally do not see the need to study anything else if you want to study gynecology. I don't believe you need to study Fu Qingzu gynecology. I don't believe you need to study the Furen Daquan Liangfang Furen Liangfang Daquan, the Song Dynasty, big Song Dynasty classic on gynecology. I mean, I don't believe you need to study Sun Simiao's myriad of formulas on gynecology. Because with these 36, if you master them well, and if you understand what part of the physiology that they fix, you won't need anything else. You won't, because that's why Zhang Dongjing left it at this number. Like, I mean, if there was a need for anything else, he would have included it. I mean, he had extensive clinical experience, so he would have seen other things, and he would have seen things that he felt like he needed to include. So it is extremely encompassing, extremely complete. So with this, you'll be fine, right? And if you do ever encounter a disease that you thought you couldn't fix with one of these formulas, let me know, because I'd love to know which one that is. And now, does that mean that these formulas fix every female's disease? No, of course not, because curing something is different than treating something, right? I'm just talking about when you do your proper diagnosis analysis of the problem, is there an answer to that riddle in the Jingui? Yes. And as far as I'm concerned, I have yet to find a female patient who has a problem for which I don't find an answer in these writings, right? Does that mean it cures it? I mean, that's a different story. Some people get better, some people, they only get a little bit better, some people don't respond at all. Doesn't mean that my formula was the wrong formula, right? And that is, of course, also something that is difficult to know. It takes a lot of experience to be able to know what the right formula is for what problem. It takes even way more experience to know that even though you've given the formula and it doesn't respond, to know that actually it's still the right formula. Does that make sense? That's a very difficult thing. And because most people don't have that ability to be certain that the diagnosis was accurate and therefore treatment was accurate, right? And that when it doesn't work, they don't have that certainty. That's why they'll doubt the treatment and they'll try to switch it up, and then they'll try to reach for formulas that are outside of our system and this and this and that. And that's how new systems are born. New systems are always born due to a lack of skill in one system. And then they're like, I've tried to Shanghai, it didn't really work, so I had to use something else. What, you're the benchmark now? You know what I mean? It's impossible, right? So how well do you know the system? So that's why sometimes it just takes time. Some people just aren't going to respond, no matter what you do. Some people might only respond to a different practitioner. That's just karma. There's nothing you can do about that, right? But you just got to stick to your system. You can't start, changing your system just because one patient doesn't respond the way you would like it to, right? That's important. Good. So this way you can kind of follow when Zhang says the 36 diseases, which 36 are they? You can kind of follow his train of thought a bit, right? And we start with number 1, and the number 1 is, of course, pregnancy in and of itself. Just the fact that you're happily pregnant already can cause a little bit of discomfort. It's not a disease. It's not contagious, right? It's not a problem. It's just, but you could still get a little bit uncomfortable, right? And of course, there's varying degrees of discomfort, right? So here, the master says, when women have a balanced pulse, right? So both hands are pretty balanced, pretty healthy pulse, but the yin pulse, which is the right pulse, is slightly weaker, and the person is thirsty. What does it mean? And there's inability to eat. Though without chills or fever, it is called pregnancy, and Gui Zhi Tang governs. So the treatment for pregnancy is Gui Zhi Tang. What does that mean? It means that when a person gets pregnant, then that person can develop a little bit of inability to eat, which means that their stomach is a little queasy, and they develop some thirst, which means that they're actually running a bit dry in the interior. Right. So then the treatment. Why do they run a bit dry in the interior? Well, the yin pulse, which is the right pulse, which is the pulse that talks about everything material in your body, the nutritive in the body and the chi in the body, right? Everything that moistens you, nourishes you. The yin pulse is a bit weak, which means the fluids are a little bit depleted. Why? Because, of course, you're developing 2 heartbeats. You've got more yang, right? You need to also support the yin. The nutritive is what is going to fuel the growth of the baby, right? So the nutritive is what is going to nourish it's not yet a baby, obviously, but it's just cellular at this stage. But that's what's feeding it. So you need to make sure that there's enough fluids in the body. So it is called pregnancy, and Gui Zhi Tang governs, right? Gui Zhi Tang governs. Gui Zhi Tang, what is the standard pulse for Gui Zhi Tang?
Floating left moderate.
Yeah, floating moderate left swing. That's the standard pulse for pregnancy. The only difference is that, so Gui Zhi Tang pulse is a pregnancy pulse. The only difference is that it does indeed get a little bit more slippery. But not in the beginning, though. The early onset, it doesn't really get that slipperiness. As soon as the primordial heartbeat has kicked in, then you have a little bit of slipperiness that kicks in. But just the original doesn't really create slipperiness, right? Now, I think we saw a patient yesterday who had insemination done, right? Recently. Her pulse very much manifested with that kind of pulse. But her pulse, Her slipperiness was just, I think, the hormones that were being administered to her, because that also creates that kind of slipperiness. So, I mean, that's why I didn't even talk about it. Oh, your pulse could be a pregnancy pulse. I'm not even going to go there because, especially because they want it so bad, and then you say, and then, oh my God, they're so happy, and, and then if it isn't the case, or if they lose it again, you know what I mean? I'm just not going to go there, so. But that pulse, to me, was a little bit like that. I once had a case, it was very interesting. I was doing clinic day in Melbourne, ICM, and one of the students got a treatment. Female student, early 30s, something like that. And I'm sitting there, and she's had miscarriage before, and you're trying to get pregnant? Yeah, we're trying to get pregnant. We're not using any precaution or anything like that. Okay, so whatever. And so I'm taking her pulse. I'm like, no, actually we didn't talk about that. But she mentioned a miscarriage previously, and I'm like, okay, well, if there had been a miscarriage, maybe we need to get rid of some blood stasis or something like that, right? Okay, well, I take her pulse. I'm like, oh, wait a minute. I said, is there any chance you could be pregnant right now? She's like, yeah, I mean, we're not using precaution. We're trying. We're not using precaution, but I don't think so. I mean, it's just, I don't think so. I don't know where I am in my cycle, but I don't think I am. Lo and behold, because she had that pulse, lo and behold, turned out that, a month later or so, she messaged me on Facebook saying, oh my God, you totally called it. I actually am pregnant. And I had put her on a Gui Zhi one at the time. So I'm like, you might want to stop that formula right now. I mean, she was fine, though, but in the meantime, baby's born, everything. Because it did fit the pattern, and I always believe that when something fits the pattern, the strength of the formula is commensurate to the strength of the problem, and there shouldn't be any collateral damage. But, nevertheless, I just don't want to, I don't want to risk anything, especially with pregnancies, right? You don't want to risk anything. I'm not, that's always the thing. It's like, wow, even I kind of shy away from that because, there's a reason why obstetrics is the most litigious field in medicine, right? You just want to be very careful with that, just out of practical consideration. You don't want to use herbs unless you really, really have to, and then you want to do it carefully. But that's that typical pulse there. So Gui Zhi Tang is the formula that governs. Now, what is Gui Zhi Tang? Is it a yin tonic or a yang tonic? It's both, right? But on which one is the emphasis? On yang. Why? More pungent than sour, right? So you've got 18 grams of pungent with the sweets versus 9 grams of sour with the sweets, right? So you have more yang building, and then secondary you have yin building. So the yin building is for that weak right pulse, right? The yang building is to help with that primordial heartbeat and to lift upwards, to kind of make sure you have enough yang inside the yin to anchor and consolidate and strengthen, so that you don't lose anything, right? So that's important. So that's Gui Zhi Tang helps you lift. It tonifies the heart yang of the little cells that are now dividing. I mean, it's not necessarily a heart yet, but it is the formula for the primordial heart yang. And then it nourishes the fluids. And I did have a patient once who, there was something about, there was a primordial heartbeat, but there was something about it in that, I don't exactly know what kind of condition it was, but it was too weak, or it wasn't strong enough, or was something, and they thought, yeah, she'll probably lose it because the heartbeat is very, very weak, so it's probably not going to last. And then she came in to see me, and it was a standard presentation pulse like here, and I just gave Gui Zhi Tang straight up, and totally strengthened the primordial heartbeat, and she kept it, and fine. But in the meantime, child's been is born, and I don't know, might be a year old by now or something like that. So this is really very important that in the initial stages, this is the primary formula. Now, practically speaking, because of what I just said, OBGYN is a litigious field, and you want to be careful, you don't want to risk anything. Practically speaking, I tend to not treat during the first 2 months unless truly necessary. Right? So you've been with a patient, and then You've been prepping them, they've been trying to get pregnant, and then all of a sudden they get pregnant. And then normally I say, unless something goes wrong, just come back towards the end of the second month, maybe the beginning of the third month or middle of the third month, and then we'll start nourishing. Right? Like I try to not rock the boat too much in the first trimester. However, if there is something that needs to be done, of course, then you need to treat it. So just treating of the pregnancy, that's Gui Zhi Tang. Straight up, simple. It's very healthy for you. It tastes good. You know, it's not a risk. Gui Zhi. One thing is like, Arno, you often caution against the use of Gui Zhi. Yes, I do caution against the use of Gui Zhi because Gui Zhi warms the blood, stirs the blood, moves the blood, right? It warms the blood in the uterus, and of course, when Jueyin warms up, Jueyin tends to open, right? Gui Zhi is the primary herb to open Jueyin, right? And Jueyin wants to stay closed. So, why are you using Gui Zhi? Well, you'll never use Gui Zhi without Bai Xiao. So, you don't see a whole lot of Gui Zhi in pregnancy chapter to begin with. When you see Gui Zhi in the pregnancy chapter, you always see it with a lot of Bai Xiao, right? Either 1-to-1 at least or more. Even Gui Zhi Fuling 1, it's 1-to-1, right? Xiao Jianzhong Tang, it's 2-to-1 Bai Xiao 2, Gui Zhi 1, and so forth, right? And then, of course, as you go farther along towards the final trimester, you no longer see the use of Gui Zhi. And at that point, you see the use of Chuanqiong as a substitute, right? But also with Bai Xiao. Also not without Bai Xiao. You won't see Chuanqiong without Bai Xiao either, right? So Gui Zhi is kind of the herb that we're a little bit careful with. According to the rules, this pattern should present after 60 days, right? Normally, this kind of pattern where the women have a bit of inability to eat, the nutritive is a little bit weak, right? They need this kind of treatment that is normally present after 60 days, right? You can catch it earlier, yeah, but if you know, like from pulse diagnosis, you also know that if you want to diagnose for a pregnancy, before the first 2 months, it's difficult to get a very accurate read because some people, they don't really show that typical pulse. But if you're pregnant, then after 2 months, everybody shows that pulse. Everybody shows that left chun that's more elevated, left chun that's a bit more floating, a bit more slippery, it has a bit more of that rolling quality to it, right? Everybody will show that pulse. After at least 2 months, you'll see it, right? In case a doctor treats adversely, after 1 month introduces vomiting or purging, there will be termination of the pregnancy. Why would there be termination of the pregnancy? Of course, because you've robbed the body of nutritive. If you take all the nutritive out of the body, then there's no more food supply. Right? There's no more food supply to the embryo, and then, of course, you will lose it. It'll wither away, it'll die, and you will lose it. This will be termination of pregnancy. So you do nothing to get rid of the nutritive. You don't purge, you don't promote vomiting. Right? That would be the wrong treatment. Next up, for women who have a pre-existing mass, right? They have a pre-existing mass. If the period stopped, right, because you got pregnant, but before 3 months are over, again you start leaking blood. It doesn't mean your period came back and that you're not pregnant. It means it's the mass that's leaking. You see? So that's very important. So Danong Ting says, okay, we're in the pregnancy chapter, right? So we're talking about a pregnant woman, right? She used to have a mass. How do you know? Well, you were treating it. She was your patient. You're treating her fibroids. You're treating her cysts, or whatever. I mean, it's unlikely that a uterine cancer patient gets pregnant. I've never seen that. I mean, it might exist though, but I've never seen that. But people with fibroids and cysts, they do get pregnant. Very often, Western medicine tends to say, okay, you got to take those out before you can try to get pregnant. But I mean, a lot of people get pregnant. I mean, a lot of people have them, and don't even know about them, and still get pregnant. And it's not really that big of a blockage. Sometimes the size of the mass can be an issue, in that it will, if it's like grapefruit size, it might prevent the expansion of the uterus, so it really might crowd the baby. But still, even that still works, right? So there was a mass. She got pregnant, menses stopped, right? Because now the body is no longer, putting out those eggs to get pregnant, right? You are pregnant, so now all the blood is going towards the nourishment, right? But after a few months, you actually start to bleed again. It's not that you terminated the pregnancy. It's not that you're no longer pregnant. It's just that the mass is bleeding. Why? Because as you are pregnant, as that primordial heartbeat all of a sudden kicks in, as soon as the primordial heartbeat kicks in, you've got two hearts, right? And so there's more warmth to the blood. There's more yang in your body. You've got two imperial fires. You're warming up the blood. So then the blood of the uterus tends to warm up, and when something warms up, something expands. And when something expands, something more easily bleeds. So that's why there can be some leakage, right? When in pregnancy, there's dong at 6 months, like a stirring in the abdomen, pulsations, we call that, right? And 3 months prior period was uninhibited, and this is the fetus, right? If there's bleeding after menses to stop for 3 months, it's due to bad blood. So basically, the movement that you will feel at 6 months, right? And that is going to be the fetus, the fetal movement that you feel. So he said basically this patient was pregnant, stopped the period. Then the period started looks at as if the period started coming again because the bleeding started again. But actually it was the mass that was bleeding, right? At 6 months, you'll feel the baby move. You know that this is not just, you got serious palpitations going on. No, that's the baby that you feel moving, right? So that's why he says it's not just regular palpitation, it's fetal movement. It's the baby that you're feeling, right? If there's bleeding after the menses is stopped for 3 months, it is due to bad blood. So that's why he says what you have is a blood stasis bleed. A blood stasis bleed. And because the blood was warming up because of the second heartbeat, that's why it leaks, right? The reason why the bleeding doesn't stop is because the mass is not expelling. Yesterday, we have a patient who came in with lots of spotting, lots of bleeding. I diagnosed it as a blood stasis bleeding, so we decided to attack the blood a little bit, right? I hope I'm right, of course, but I think the read was pretty clear. We attacked the blood, and then by getting rid of some of the blood stasis, the bleeding should already start reducing. So briefly, of course, we're going to kick out some blood stasis. So then there's going to be some stuff coming out. But that's it, because all the blood that she was leaking was like dark and dry and like the brown stuff she says that you have at the end of your period. So obviously that's like stagnant blood, right? So I decided to do to attack the stagnant blood. And then I think that should already reduce it. And then we can go in and nourish a little bit the spleen and so forth and stop the bleeding. Now the mass might not be completely gone. If there is one, I don't know. We'll see, right? It doesn't matter really for us anyway, right? But then we have a bit more. Then she's not constantly bleeding because she's been spotting for 2 years, right? So then she's not spotting anymore constantly, which is making her really weak. And then we can see, okay, how are we going to use a strategy that keeps her strong, prevents her from bleeding, while chipping away at the mass or whatever, right? Something like that. So you have to expel the mass. If you don't expel the mass, the bleeding just can't stop, right? Therefore, you should purge the mass, and Gui Zhi Tang governs. Now, purge, the word here, xia, precipitate, descend, guide downwards, right? We translate that as purge, or we translate it as precipitate. Obviously, Gui Zhi Tang is not the strongest blood purging formula you know of. However, you should still acknowledge that Taoren is a blood descending, blood stasis attacking, blood stasis purging herb, just like Da Huang is. Remember, it's part of the bitter blood movers, right? So it's a blood mover that takes the stasis and leads it out of the body, right? It grabs the stasis and pulls it out of the body, right? So you have to attack the mass, purge the mass with Gui Zhi Tang. And I'm sure we've all used Gui Zhi Tang, and Gui Zhi Tang is known to be a formula that attacks masses. One of the things that happens in clinic is that people use Gui Zhi Tang and ultimately end up switching to something stronger because they think like nothing is changing. My experience with Gui Zhi Tang is that it's a slow formula, and Gui Zhi Tang is a formula that you have to give it the time to do its work. It is not a formula that works really fast. It's not a formula that's an active, rapid purging formula, anything like that. You just got to give it some time. Let it do its thing, Let it do its thing, right? So that's why sometimes people, they kind of switch to other formulas because they want it faster. Oh, it's not changing. No, it changes. It changes. Often with Gui Zhi Ling 1, what you have is the patience of the patient wears out. But it wasn't the wrong formula, right? And then so that's why one of the things that we see. So you should only make the formula stronger and move to a stronger blood-moving formula if indeed the pulse for that stronger formula is there. A Didan Tang or a Taho Chenchi Tang or a Xia Yushui Tang or a Dahua Mudampi Tang or something like that. If the pulse isn't there for that formula, you shouldn't go to that formula. All right, but it's a difficult one. Is the goal, and this is important here, the next thing is very important, is the goal of using Gui Zhi Ling 1 during pregnancy to get rid of all the masses before the baby is born? No. The goal is to stop the bleeding. That's all. The goal is to stop the bleeding from the mass. And the only way to stop bleeding from the mass is to attack the mass. That is a fact. You have no other way around it. You have to attack the mass a bit. Right? Chip away at the bad blood. It's almost like you got this chunk of bad blood sitting there, right? And the outer layer of it is the worst part of it. That's the stuff that's really like putrefying and bad and stuff like that. And that's the stuff that's leaking. So you kind of scrape the bad outer layer off till you get to a bit more of, it's still a mass, the mass is still there, but you get to the next layer which isn't as compromised, isn't as putrid, isn't as dead, isn't as necrotic or whatever you want to call it, and therefore it doesn't bleed so much. But the mass is still there. You don't want to try to get rid of the mass before the baby is born. You just want to stop the bleeding. That's all you want to do, right? Once she's postpartum, baby is out, there's no danger, okay, then you want to work on the mass, go for it. Then, what's a good formula postpartum to attack dry blood in the abdomen? A Xia Yushui Tang, for example, as we will see, right? Which is like a dahuang-based, dahuang powder with bugs, right? With the insect blood crackers. And go for that, no problem, go for that. At that time, it's fine, that's a postpartum formula. It's okay to do that, right? But you don't want to go too hard during the pregnancy. That's also one of the reasons why it's used as a wan. And again, it's also one of the reasons why it has baishao in it. And it just blows my mind. For so many people now have taken my courses, and I've said this a million times by now, you don't need chishao, right? If you use chishao, you are an allopath. Go do Western medicine. Stay out of Chinese medicine. You don't need chishao. That's not what this is about. It is not about, I need to make this formula stronger because this is a blood-moving formula. I need to make it stronger on the blood-moving level. If it needed to be stronger, there would have been other herbs in it. It's not necessary. Baisha is the only formula you have that is going to keep the blood layer peaceful. Right? Baishao in this formula keeps the blood layer peaceful. It protects the spleen from the wind movement that you're creating. Right? It is going to make sure that the nutritive that we just talked about, that easily kind of dries out a bit for women, that causes the thirst during the initial stages of pregnancy. It's the herb that is going to make sure that the nutritive stays stable and abundant. Right? Keep baishao. You don't need chishao. Right? I think that's the. Once you do chishao, well, then you might as well just add other blood movers anyway, because then your goal is to attack the blood, right? So then go for it, knock yourself out, right? And then you're trying to move the blood so strongly that you're going to start worrying about causing more bleeding of good blood. So then you better start adding some paojiang and some aiye and some other herbs to stop the bleeding. Well, but that's just then you're just in. Then it does never end. What's there's no more internal restraint. Sasha.
No, I was just wondering if Gui Zhi Ling 1, as you say, is a slightly weak formula, because it needs to be so in a kind of pregnancy condition, whereas otherwise we could use something stronger.
Definitely. It is definitely a weak formula because it is for pregnancy conditions, yeah. Otherwise, for a mass, you can easily go stronger, and we often go stronger, right? and then, I mean, such as like a Taohe Chenji Tang or a Dahua Mudanpi Tang, or, I mean, there's our great formulas in the Jingui. We don't really use like a Tugua Gen San or something like that, which we don't use because I don't use it, at least because I don't have access to the herb Tugua Gen. But that would be a phenomenal formula to have, like Tugua Gen San. It's also Gui Zhi Baishao based, but then it has that Tugua Gen and Zecong. So it also has a bug in there. So that's for people who have only their period every other month, right? So for blood stasis and amenorrhea, dysmenorrhea, those kind of conditions, there are lots and lots of good formulas outside of Gui Zhi Fuling 1. The only thing is that a lot of blood-moving formulas, they use Da Huang. And I think as a blood mover, and properly processed Da Huang as a blood mover should be fine. It shouldn't really give you too much loose stool, especially not if you're using the insect formulas. So if you're using Didang Tang, Didang Wan, Sha Yu Xue Tang, that kind of stuff, then you don't have Mang Shao, right? The blood-moving formulas that have Da Huang, but that also have Mang Shao, like Da Huang Mudan Pitang and Taohe Chengji Tang, by virtue of having Mang Shao, it becomes very difficult to keep a patient on these formulas for a long period of time, because it will drive too much fluids down your intestines. It will give you loose stool, and that's just uncomfortable. And as a matter of fact, over long periods of time, it's going to be too much. Like, it's going to dry your patient out. You're going to damage their fluids, and that's not a good idea, right? But the insect blood-moving formulas that have Da Huang in it, actually they don't cause loose stool. If the Da Huang is boiled, it's not like Sheng Da Huang. It's Shu Da Huang, right? Then it shouldn't cause you purgation. Again, in granules, it's a little difficult because in granules, some companies who make Shu Da Huang, it still is a bit too Sheng to my likes. I want it more Shu. I want it more boiled longer, because it does. If it's boiled shorter, it still retains a little bit of its kind of purging effect. But yes, Gui Zhi Fuling 1 is supposed to be weak. It's supposed to be a weak formula. And it's used as a pill so that you can dose it easily and that you can really use small amounts over a gradual period of time. Right? Throughout the history of Chinese medicine, as you all know, there are hundreds of thousands of formulas that exist. Right? The big formula encyclopedia, or the big formula dictionary of Chinese medicine, I think now they're up to 22 volumes. It's longer than this table. It's huge, right? There's a tremendous amount of formulas. So, even that, when you think about it, even that, like, how do you assess that? Like, just saying to me, Arnaud, you only practice Shenghan Jingui formulas? Oh, you're so rigid. You only stick to this little bit. I'm like, and to how much do you stick? In the light of the size of Chinese medicine, like what? Like, you use more formulas than me now? We got 300 formulas in our system. That's a lot of formulas. You can go challenge any practitioner out there, and there's not a single person out there who uses 300 formulas. Nobody, right? And then they tell us that we're too focused, that we're too dogmatic. People just don't know how tall the sky is, right? It's like, oh, that's not very high. Yeah, you haven't been up there, haven't you? Right? So that's the thing, right? So basically, of all the formulas that we use, because these are the blueprint formulas of the whole system of Chinese medicine. These are the blueprints. The Tang Yi Jing and the Shanghan Jingui, that's the blueprint of Chinese medicine formula science. Anything else is just, it's just freestyling on the same original theme, right? So then, another formula that is using the exact dosages as the exact ingredients as Gui Zhi Fuling 1, but as a decoction, is called Duoming Tang, and you might have heard of that one. Duoming, Duoming, and Duoming means to snatch life away, and that at one point, I don't know exactly at what time in history, but that was used as an abortion formula. So, which basically tells you that if you're using this during pregnancy as a decoction, that this is actually a very powerful formula. But if you're using it as a pill in low doses, it's powerful but very gentle and very controlled. That's basically the idea behind it. Right? Now, I do not think abortion with Chinese herbs is a good idea. Well, aside from the fact that as a Buddhist I don't think abortion is a good idea, but even just the means with which to do it, I don't really know. How do you know if it would be complete or incomplete, or I don't know how I would gauge that, right? So I think if it is necessary, I think better surgical would still be better, and then we have plenty of ways to deal with post-surgical problems right after that. Good, that is Gui Zhi Tang 1. Right. Next is cramping pain in the abdomen during pregnancy. It could not be simpler to treat. It could not be simpler to treat. Now, again, my personal view on this, it all depends on what stage of the pregnancy that we are talking about. Right? It is very unlikely that people have strong cramping in the initial stages, right? But they get ultimately after maybe, towards the end of the first trimester and starting with the second trimester, people can start to have some cramping, right? It doesn't mean that they're having contractions to the point that actually the baby is getting driven out, right? But cramping is a mild form of contraction, right? And cramping is wind that is stirring because Jain is trying to open, right? Jain wind is fanning, and the Jain wind fans is what causes Jain to open. If Jain wind doesn't fan, Jain cannot open, right? So the little bit of the cramping, the contracting is like a very, very, very mild contraction, right? What is the primary herb then to kind of still that wind? Bai Shao. Bai Shao is the primary herb to still that wind. So if there is any type of cramping in the first trimester, and especially the first half of the second trimester, so let's say second half of the first trimester, first half of the second trimester, like in those 3 months' time, that type of cramping, in my opinion, is actually more easily addressed with a Xiao Jianzhong Tang. Why? Because you're using the Gui Zhi Tang, which is the primary formula for pregnancy. It nourishes, blah, 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 right? Harmonizes yin and yang, gives you a little bit of lift, that kind of stuff. But you also have extra Bai Shao to kind of still the wind and stop the cramping. So you're kind of hitting both at the same time. It is my experience that Dangui Shaoyao-san type of cramping is more when there already is an actual baby inside you. Not just a cellular level, not just embryo, not just fetus, but it's a baby. We're talking towards the end of second trimester and then all throughout the third trimester. That's truly when Dangui Bai Shao Chuanchong comes into play. That's when Gui Zhi exits left stage and Chuanchong enters the scene. Right? So there has to be more of a baby at that point. When the uterus is getting really stretched, right, and therefore it's under tension, that's when you need that Dangui to relax the contraction of the uterus, to moderate the spasming of the uterus, right? The Chuanchong to help lift the fetus, right? The Bai Shao to stop the contracting of the uterus. That would be cramping the space of the baby. And then the baby, as soon as you cramp their space, they're like, wait, yo, mom. And then they'll start kicking and pushing and they'll like try to stretch it out, right? Because it's like, trying to contract them, like, whoa, what's going on here? Just like in Star Wars, when they were in the compactor, same thing. Did you see how, Han Solo was really vexed? And so, the same thing. So, I would say Dangui Shaoyao-san is the formula for cramping throughout pregnancy. So strictly speaking, doesn't matter what stage. But clinically, you're more likely to see the Jianzhong Tang, or if you want to go even simpler, without the nourishment, just Gui Zhi Jia Shaoyao Tang. Right? Just Gui Zhi Tang with double Bai Shao. You'll see those much more in the first trimester and the beginning of the second trimester. As soon as you get into the second half of the second trimester and then all throughout the third trimester, okay, then that's standard Dangui Shaoyao-san. And it's pretty straightforward stuff. I mean, Dangui Shayasan, it is also mentioned in the actual Just Complex Diseases for Women chapter, which basically it is the formula for abdominal pain in women. Right? Because women are more blood-based, men are more water-based, right? So it is the blood-based abdominal pain formula, which means the blood is a bit weak, the liver suffers a little bit of urgency because the blood is a bit too weak, so the wind is fanning a bit too much, you know what I mean? So it's getting unhappy. And of course, because the blood is weak, and because the wind is fanning, and because the liver gets that kind of cramping and stuff like that, that's why there's less control of wood, proper control of wood on earth. There's pathological invasion of wood on earth, but there's less proper control of wood on earth. And because of that, the earth is also not really doing its job, which is what? Controlling the water. Right? And that's why there's so many water herbs in this formula. Because wind is pathologically invading the earth. The earth is like, that's it, I quit. Doesn't do the job anymore, walks off the job, goes on strike. And then, of course, water is like, right? And then this water just accumulates because there's nobody cracking down on water anymore. Water accumulates, and that's how you get this vicious triangle that you can't snap out of. Water accumulates, stops feeding wood, because when an organ goes pathological, it shuts down its generation cycle, and the first thing it'll do will also be suppressing the control cycle, right? So then there's also going to be a lot of pulsations in the abdomen. Why? Because the water is now going to invade fire. As you will see in your Jingui abdominal diagnosis class in September, October, something like that, right? Dangui Shayasan, lots of abdominal pulsations, but no Gui Zhi because of Chuanchong, right? Chuanchong will support the heart. Chuanchong Fu Xin Yang, right? It supports the yang of the heart. It lifts blood back into the heart. It pumps the blood back into the heart. So the heart is stronger, and with every beat, it instills fear in the hearts of its people. Right? You know, as the emperor gets stronger, everyone's like, whoa, no rebellion here, because dude's kind of badass. Right? So, and that's how you can subdue the pulsations, because there's a lot of pulsations in Dangui Shayasan. And the water that is stuck, it doesn't feed into the drained wood anymore, and then that's why it doesn't reach up into the heart anymore. It weighs on the abdominal aorta and creates all these pulsations. And trust me, once you are pregnant and you have a big full belly, there's a lot of water coming up. There's a lot of tendency to have shortness of breath, water coming up, pulsations in the abdomen, palpitations, all of those things. Anxiety. It is not just that you're afraid of what is about to come, or whatever, it's your first child, and fear of the unknown. No, also the fact that you're developing so much water in your abdomen that is weighing on the aorta, that it's putting kind of that rebellious pressure back into the heart, like a running piglet almost, that also is part of your anxiety. You know, you're more prone to palpitations, a bit more fear-based, right, because of the problem. So that's why Dangui Shayasan has so many water herbs in the formula, right? Dangui Shayasan, in original formula, it's a powder, it's ground up, and you take it with some alcohol, right? Because that makes it go into the bloodstream, it's more warming for the interior, those kinds of things. Nowadays, I just do granules. When people need Dangui Shayasan, I just say, just do granules, because granules is kind of a nice in-between between decoction and true powder anyway. Yeah, I know I'm not a purist, but that's also because, well, you know, modern society, patience, compliance, all of those things come into play. If something says wan or san in the original times, then that's a really good candidate for a granule, right? So if something says tang and you're doing a granule, you know that it's going to work slower and less strongly than if it was a true decoction. That's just how it is, right? Of course, if you could make the original formula, that's fine. If I do granules, I stick to the original dosages, which means that your baishao is at 48 grams and your chuanchong is at 24 grams, right? And actually, you could also do that as a decoction. And I've even done that as a decoction for pregnant patients. But it actually isn't really necessary. You can just do granules, and that's just going to be fine. But even as a decoction, it is safe. The high amount of baisha is still pretty safe. The fact of the matter is, though, sometimes some patients, because baisha is quite cooling for the stomach, right? Because it has that kind of endogenic stomach heat clearing aspect that we talked about before, right? Some people get a bit of loose stool with Dangui Shayasan. That is true. So then maybe you go to Xiao Jiandong, which has less baishao, or maybe you have to add some herbs. And at times I've added ginger to it, or I've added some fudzu to it, depending on what was necessary. But again, fudzu during pregnancy, it's one of those things. Is it allowed or no? Yes, it is totally allowed. Actually, the next slide talks about that exactly, right? It's using fudzu tang during pregnancy, right? However, because of OBGYN being the most litigious field of medicine, because you really don't want to hurt a patient. I mean, no matter how much we like our medicine and want to help our patients, you definitely first don't want to do any harm, and you don't want to have to deal with that kind of stuff. You only use it really when it's necessary, right? But if you've given them Dangui Shayasan and it still is the pulse and the abdominal pain hasn't gone away, add a little bit of fudzu to that. But then start low. I mean, don't just go all cowboy like you would do with a guy or a non-pregnant patient, right? Because there's no risk at that point. But, because fudzu, if the fudzu is properly processed, normally you don't have to worry about anything. Except if you were to go to very, very high doses, right? But unlikely any of you would go there anyway, right? If the fudzu is properly processed, then it actually shouldn't have the abortive effect that it has according to the Benzhao, right? The Benzhao says fudzu can abort a fetus. Yeah, unprocessed fudzu. It can abort an elephant fetus also. You know what I mean? It's highly toxic, so of course it can abort a fetus. So, but if it's processed properly and it's in a formula context, it's very safe. It's very safe. All right. So same thing. If the baishao doesn't stop the abdominal pain, it must be a baishao fudzu abdominal pain, right? And then those two herbs come together, which is a nice segue to the next theme of the next slide, right? When the woman is 6 months pregnant with a wiry pulse and fever, right? Wiry is a pain pulse. Fever means young is floating. Feeling that the fetus is distending more, feeling like all of a sudden like the belly is really getting big. Is that normal that the belly all of a sudden should be really getting big? No, it means you're bloated. Like, why is your belly getting big? There is cold air and cold water accumulating in your abdomen, right? Abdominal pain, aversion to cold, right? Abdominal pain, distension, contraction. Aversion to cold, of course, because it's all cold water and all cold air in the abdomen, right? And as if a fanning sensation in the lesser abdomen, kind of like a spasming, kind of mild sensation of contraction starting to happen in the lower abdomen. Why can you have contraction that starts to happen due to cold? Not just, I'm not talking contraction as in like something contracts because it's cold, but like rhythmical contraction that happens because of cold. It's the same mechanism like a Wume-1 wind, right? When the body starts to cool off on the interior, right, then basically the temperature between north and south changes. The temperature differential between north and south changes. And when the temperature difference between north and south becomes greater, more internal wind is generated because of that. Right? So that's why the wood element, the wind, the drain element, starts to have more wind in it, because the north of your body, the lower burner, cooled off too much. So if you have a lot of cold, young deficiency cold, right, in the abdomen, you actually have a risk of having miscarriage. Right? Here he says there's a fanning sensation in the lesser abdomen, which means that there's a bit of a contraction starting to happen. Why is this? Because the child viscera is opening. The uterus is opening. Too much wind is fanning. And when wind fans, drain opens. Right? So you need to shut that down. But this type of shutting down of the wind is not just baishao, sour by itself. If you were just to put a baishao in there, or even just put a Dangui Shayasan in there, ultimately, Dangui Shayasan actually is a bit of a cooling formula. Yes, I know that the Dangui and the Chuanchong, they kind of preserve the warmth of the blood, like they make sure that the blood doesn't cool off too much. True. But actually, the baishao at such a high dose, and then all those diuretics, which when you pee, you cool off, right? It actually is a bit of a cooling formula, right? So you can't really use Dangui Shayasan. Of course, you can't use it because it's not even the same problem. I mean, Dangui Shayasan is a blood layer abdominal pain. Right? Fu Zhi Tang is a water layer abdominal pain. So the water is too cold, and it's like as if your uterus is like floating in ice cold water, and then the uterus is like, oh, I don't think so. And so it's starting to contract, and it's like the uterus is shivering because it's too cold, and then there's a risk that you lose the child. So you have to quickly warm the viscera, right? You have to warm the uterus with Fu Zhi Tang. But does Fu Zhi Tang warm the uterus directly? No, it warms it indirectly. It warms the water that in which the uterus is floating. Because the uterus is in the north of your body, which basically means it's submerged underwater, right? That's why the baby, got this mucus plug, because otherwise it'd suffocate, right? It's not the man of Atlantis, right? So, which is David Toon, by the way. Basically, the uterus is floating in water. You warm the water, the uterus warms up, right? And so Fu Zhi Tang is the primary formula to do that. Now, there is a bit of trepidation before you use Fu Zhi Tang in a pregnancy case, always. I mean, the first time I did that, I was mildly concerned. More than mildly concerned, of course, right? First, I remember the first case I did this was a really, really good learning case for me. Patient came in and she'd done all her homework, made my job easier because she was an acupuncturist herself, right? Which is good because then at least she's tried acupuncture. She had tremendous pain in the sacrum and cramping in the uterus. So her sacrum was extremely painful and felt like really tight and contracted, right? And then her uterus also had like a little bit of contractions. And she actually was more than 6 months. She was like, I'm going to say 7.5 months along, something like that. Done acupuncture, chiropractic, massage, naturopathic medicine, gone to the regular MD, I don't know, faith healing, whatever. I mean, she'd done everything, hot tubbing, anything. She tried everything. Right? Which makes it easier for me, right? And also she'd gone to see another herbalist at the time, who had been doing all kinds of different formulas with her, and nothing had worked. So it kind of made my job easier. Right? Took her pulse, deep, faint, with wiry, right? Like a typical cold water pulse with pain, right? And so I said, well, and of course the problem is convincing the other acupuncturists that she needs to take aconite during pregnancy, right? That's always a bit of a challenge. And so I said, well, this is it. This is the formula you need. She's like, oh, it's impossible. I'm like, well, then I can't help you. Because I cannot come up with anything else. You've tried everything else. You've tried any modality in the book, right? The pulse fits. It fits the line. This is what you need, right? And so she got the herbs in bulk, boiled it up, drank 1 cup in in the morning or something like that. And then I think drank another cup in the afternoon. And by the time she drank like half a cup at night, the problem was gone. It was that fast. Right. And then she's like, oh, I'm just going to stop, which is fine. I mean, I wish she would have done I would have been like, take 1 more day at least so you could, make sure that, it's good. But she was so scared of the herbs. But she tried it because she was desperate, and it was really the formula, and it went away in a day. It was really, really fast. So with bulk especially, it goes really fast, right? I mean, if it's thumbs up or thumbs down, really fast. So that was the first time I did that. And in the meantime, I got my feet wet. I'm like, okay, this is safe, this works well, and then ultimately I've recognized more patterns like that, and I've done it many times, and it's I've never had any problems with this whatsoever. And again, Fu Zhi Tang is one of those formulas that has foods in it, but it has Bai Shao in it. So again, there is that kind of wind calming quality to it, because the water in the north is really cooling off. I mean, don't forget this with Fu Zhi Tang and Zhenwu Tang, right? When the water in the north cools off, and because of the water in the north cooling off, the water stagnates. There's less water feeding into the wood. So first thing, the north cools off, temperature differential between north and south increases, more internal wind. Check. Second of all, the water is stagnant, not going into the wood, because it's ice cold water, right? It's not going into the wood. It's not getting steamed up to reach the roots of the tree, right? So then the wood gets also more dry, also more wind. That's why it's not just Baishao is in Fuzutang and Zenwutang, not just because in the original text of the Bensao Jing it is said to have a diuretic function. It's also not only because it gives earth a little bit more room, so it can control the water, kind of tonifies the earth by backing wood off of it. Yeah, also true, but also not one of the main things. The third thing is that indeed those formulas have internal wind. They have a little bit of internal wind, right? And that's why it's very similar to a Sinisan. Like if you look at the Zenwutang, all the things that Zenwutang treats and all the things that Sinisan treats, it's very similar, which is also an important Baishao formula, right? So from that perspective. So there's a bit of internal wind that these formulas can treat. And that's also why in our system, Zenwutang or Fuzutang are such good hypertension formulas. Not only because they're diuretics, but also because they treat a little bit of wind. Right? By warming the north, it actually stills internal wind indirectly. And it kind of reduces the wind fanning from wood with Baishao. Right? So that's Fuzutang to prevent miscarriage. Right? This is mostly like characterized by pain, contraction, cold, those kinds of things in the lower abdomen, right? But the amount of Baishao is so much lower that the pulse is very different. For example, at Dangui Shayasan. Dangui Shayasan has so much Baishao. You have such a big right guan because of so much wind invading earth, right? This one, not so much. This is not that. It's mostly faint, weak, deep, thin, wiry for the water, that kind of stuff. Right, so that's a dead giveaway. Yes.
So it seemed in a lot of your exit strategies regarding the OBGYN cases yesterday, tertiary formulas, you have Tang in there because you're really protecting the blood there by going through the water layer as well.
Yeah, Danlongjing.
Because you're nourishing with Dangui Shayasan, I think, and then you're adding
A little bit of food, yeah, exactly. So Danlongjing is extremely careful about going into the blood layer. Any time, really, he is really careful with that. But during pregnancy especially, he's very careful with that. So, because it's kind of like, it hits home really close, right? So it's kind of like, you have to be really careful. You don't have a whole lot of room for error when you're in the blood layer. So that's why he tries to do as much as possible through the fluid layer, right? For example, right, recently there was a discussion on the forum about the whole Dr. Tian modification of Xiao Cai Hutang during the period, right? During the period, we take Huangqin out, Baishao Mudan Pi in, right? And so it brought up a whole lot of discussion, and people like, well, Danlongjing doesn't even take Huangqin out and put Baishao Mudan Pi in. Sure, that's fine, that's true. He does use Huangqin during pregnancy. Just be aware that it might cause a bit of abdominal pain, and therefore, if there is a bit of abdominal pain during the pregnancy, did I say pregnancy? I meant menses. If there is abdominal pain and a person needs Xiao Cai Hutang, what's the modification? Already plus Baishao in, right? If urination is difficult, which means lower burn risk cold, what's the modification? Huangqin out. You know what I mean? Like Danlongjing has those things, right? And show me a woman who doesn't get any type of abdominal pain during her menses. I mean, most do. 7 or 8 out of 10, I would say, get some type of abdominal pain during their menses. So if they need Xiao Cai Hutang already right there, I think it's better to take Huangqin out and Baishao in. But then Huangqin out, that's more for urinary, but Huangqin out, then you don't really have any more cooling for the ministerial fire, and that's why Dr. Tian then introduces Mudan Pi in. Drain is open, blood is moving, it's fine to use a blood mover, like a Mudan Pi. But it cools the ministerial fire. Right? But it makes sure the blood keeps moving, as opposed to Huangqin, which would cool the fluids around the blood, and that would actually make the blood kind of clot up more, because you'd actually be cooling the blood from the outside. You know what I mean? You don't have that built-in movement that goes with it. Right? So then the question would be, if that is indeed true, that you say that Huangqin cools the blood, Mudan Pi does the same thing, Mudan Pi is the blood layer equivalent of Huangqin being a bit more fluid layer, then why does Danlongjing not use Mudan Pi during pregnancy to calm the fetus? Exactly, because it hits too close to home. It's already in the blood layer. Right? He uses Huangqin because he's kind of just from the outside, we're going to cool off the water. not by going into the actual blood, by going into the uterus and changing it there, but by just kind of changing the temperature around the uterus to then secondarily change the temperature inside the uterus, right? So he's just more careful.
And my question, just so you guys are clear, with people that were working towards fertility,
Mm-hmm.
where is that?
Yeah. As soon as this patient were to get pregnant, we'd be looking at something like a Gui Zhi Tang to start, and then the typical Dr. Tian second trimester Huang Qi Jian Zong Tang to lift and nourish. And
I don't know if it was Alan or someone earlier in the forum had posted like, oh, that's 2 pregnancy cases using Gui Zhi Tang.
mm-hmm.
You know, I was kind of curious as to that, and you've explained it today.
Yeah, exactly, yeah. Gui Zhi Tang is nourishing the fluids, harmonizing the fluids, supporting young, lifting young, with a slight emphasis on lift, right? So it's the Buzong-Ichi principle. Everybody thinks that lifting is only Buzong-Ichi Tang. Oh, lifting. No, it's like Gui Zhi Tang is lift, right? Huangqi Jianzong Tang is lift. Those are the Yangdan Tangs. Yangdan is the sun is rising, right? The sun doesn't rise down. That's sunset. The sun is rising. So sunrise, the minor sunrise formula is Gui Zhi Tang, and the major sunrise formula is Huangqi Jianzong Tang, and the major decoction in the decoction classic is always for more accompanying deficiency. That's why first trimester minor young rising decoction, second trimester major young rising decoction. That's our standard treatment, right? Until the baby is so like established and strong, and heart rate is fine, and fluids are nourished, and baby is growing, and then we actually have a little person in there with a personality, and then you need to start managing the personality with calming the fetus, herbs, and kind of, making sure that there's enough space in the uterus, that it's not too contracted with Dangui Shayasan and those kinds of things. Right, yeah. I mean, I have treated so many pregnant women, aside from the fact that I am a father of 2 children. You know what I mean? Like, I've done that. I've watched that on a daily basis, see all those changes, and done formulas constantly, and postpartum and all of that. So I'm very happy to have had that experience, because I can relate to other pregnant people also, including relating to the husbands. And so, but just being able to see that, and then doing that with patients, I've really done that with many, many patients, has guided them from infertility to conception to gestation in the different stages that things might have happened, and it's always the way it's described here. I mean, I've never seen something outside of these formulas that Dao Nongjing mentions. It is amazing, And so, and then postpartum, and whether it's blood, whether it's like pelvic inflammation, whether it's, I've seen so many different things there too. I don't specialize in gynecology or OBGYN, but it is a public secret that there's more women who seek out alternative medicine than men. So ultimately, our clinics still have more female patients than male patients, so. Although I must say that over the years, I've gone to a healthy half almost now, but still, I think probably just a little bit more women still. But it's gone more. I've gotten more men also, but in general, I think we get more women in our medicine. Yeah, so it's good for business to know how to treat gynecology and obstetrics and things like that. Good. Let's take a little break.